4th of July, you know it's packed with fireworks and food and fun, and whether you're lighting the sparklers or grilling the hamburgers or just hanging out by the water, staying safe makes or breaks the holiday. Whitney Crain, a physician assistant with Cone Health Primary Care and Sports Medicine at the MedCenter Kernersville, is here to talk about how to celebrate safely and avoid that trip to the emergency room, because we all want to avoid that trip to the emergency room, don't we? Okay, let's just start with the first thing that we think of with July 4th. That's fireworks. What's the #1 safety mistake people make, and what injuries do you see as a result of that?
Sure. So first and foremost, maintaining a safe distance, of course, is key. A lot of times we want the best display possible, so we'll light up numerous fireworks and try to light them all at once. But of course, this prevents us from maintaining that safe distance. Similarly, if you have sparklers or something in your hand and again want a giant display, lighting them all at one time increases the temperature and thus increasing the risk of burns. Another thing that we see commonly, of course, you want the most bang for your buck. If you have a firework that only partially goes off, please do not try and relight that. It can explode at any point in time, thus increasing the risk of injury. Duds are one that doesn't go off initially. Also, please do not try and relight. Always try and have a safety or backup plan, have a bucket of water or a hose, just in the case of injury or a fire. Common injuries, of course, we're dealing with something hot, so we see burns all the time. 60% of those usually include the hands, the fingers, the face, or the ears.
Yeah, I can imagine so. Okay, so the staple for 4th of July, every kid I've ever known has grown up with them. We probably had it too, the sparklers. Let's talk about safety for kids and sparklers.
So sparklers, while they look harmless, should not be used in children under the age of 5. Believe it or not, sparklers actually burn at very high temperatures, reaching all the way up to 2,000 degrees Fahrenheit. So if you can imagine a small child grabbing that, high risk of burns. Little children also don't have the fine motor skills or the dexterity in their hands to hold such a small little sparkler, and thus increasing the risk of grabbing it at the wrong spot or burning their fingers. Safer alternatives to that would be glow sticks. What can you do if the sparklers are around to prevent a little one from grabbing that? You can have a bucket of water, and after it's done burning, rather than placing it on the ground, put it in that bucket of water, again, to remind that little child not to grab that high temperature object.
All right, with that being such a big thing, you know, the heat and the burns and things of that nature, what can we treat at home, and what needs medical care if someone were to get hurt at our 4th of July party?
Sure. So many burns can be treated at home initially. A common misconception is you just burned yourself with something hot, so let's rush it under cold water or place ice on it. But the problem is actually using some cold temperature can further damage the tissue underneath of it. So we'd request that you use room temperature water and a mild soap like Dove, and just scrub, trying to remove anything that could have been contaminated in that wound. After cleaning the wound, we'd recommend using some type of either Vasatrace, an antibiotic ointment, or a Vaseline. These act as barrier creams and prevent anything from getting inside of it. They also provide moisture. In the hands, the arms, the legs, any potential area that could be contaminated, you can then cover it with a non-stick pad, again, just to prevent any infection. Sometimes, unfortunately, burns can lead to the urgent care or emergency room. If you have a 3rd-degree burn, these are much more serious. They involve all layers of the skin. And commonly, you can tell just by looking at the skin if it looks white or charred or leathery in appearance. Sometimes that can indicate it's a deeper burn. If there are signs of infection, pain, redness, swelling, warmth, drainage, these would be signs that a burn needs some further medical attention. And then lastly, any burn that involves a large surface area or a large portion of the body, we would recommend medical attention.
That's a good thing about the whole not ice on the burn, because I think we were all told to put something as cold as you can on that burn. So I'm glad that you clarified that. Let's talk about grilling. It is, of course, a July 4th tradition. Let's talk about some safety to preventing fires and for getting things out of control.
As far as grilling?
Mm-hmm.
Yes, yeah. So when it comes to the grill, of course, having a well-ventilated area is important. Obviously, the weather can take a turn for the worse, and so if you try to move it indoors, please make sure that there's some form of ventilation to prevent not only a fire, but also a respiratory or an inhalational injury. If grilling outside, making sure that the tree branches or bushes are not too close to the grill. Keeping children away from the grill. Of course, we don't want little hands getting close to such a hot object. Long utensils or spatulas, tongs, these can help you to flip your food without risking a burn on the forearm. And then lastly, making sure that you're cleaning your grill on a routine basis, of course. If there's a lot of grease, that can lead to grease fires. So cleaning the grill, removing the grease traps, this would be helpful.
We had one more note about the grill, and that is what you're cleaning it with.
Yeah, so they do have chemical cleaners out there that are actually unsafe to use. Many of them have sodium hydroxide or potassium hydroxide, and these can actually be caustic to the skin if not handled appropriately. So we would recommend safer items such as baking soda. You can use vinegar, you can use lemon or lime juice to clean it, just to prevent any inhalational injuries or some skin burns.
All right, and a lot of people like to clean with like a wire grill brush, but we've seen sometimes what happens. And if you haven't heard what happens with the wire grill brush, let us know.
Yes, grill brushes that have those wire little bristles as you're cleaning them, particularly as the brush ages, they can fall off and be hidden inside the grill grate. So as you're cooking your food, of course, it can get stuck on there, leading to accidental ingestion injuries. To the point where it can cause problems with the throat, the esophagus, or the digestive tract, and in severe cases lead to a surgical procedure. So a much safer cleaning object would be a pumice stone, or they have wooden scrapers that help remove it without that type of injury.
Yeah, we've actually done stories on people who have ingested a wire from the grill brush. Okay, let's move on to water safety, pools, splash pads, the beach, you name it, people are going to be at the water.
Absolutely. And a misconception that we have, particularly at a crowded pool, is there's a lot of adults, there's a lot of eyes. Sure, clearly the children are all safe. The problem is all these other people are not watching your child. So it is very, very important that you have a designated sober adult that is keeping track of each individual child. Additionally, having a approved flotation device or life jacket that's approved for the weight of the child, even if they seem like a strong swimmer, making sure that we're vigilant at all points in time, because it just takes one little second and it doesn't matter how deep the water is.
All right, aside from the danger in the water, there's danger outside the water. A lot of people, they're running at the pool or whatever else, they slip, they fall. Let's talk about slips and falls for, a variety of reasons. What do we need to watch out for?
Sure. Obviously, if you fall and hit your head, particularly if you're running on that pool, even after your mom screams and yells at you not to, you fall and hit your head. There's some obvious symptoms, such as a severe headache that doesn't respond to Tylenol or ibuprofen. If you lose consciousness, if you have a seizure, change in vision, dizziness, I feel like most people would probably go to the emergency room, but there's some other symptoms that may not be quite as obvious to people. After having a head trauma or slipping and falling, if you develop clear fluid that's coming from your nose or your ears, if all of a sudden you just have a personality change, or you feel really fatigued and tired for some reason, nausea or persistent vomiting, these can all be symptoms that something much more severe is occurring. And if these happen, please seek emergency care.
Yeah, don't pass that off of, oh, they must have gotten the stomach bug at the same time when they hit their head. Actually call the doctor on that one. Okay, let's talk about heat, overheating, dehydration. It's going to be a hot one for July 4th. I think the projected forecast is 90 degrees right now.
Yeah, so dehydration, obviously our first sign of that usually is thirst. Our body will tell us, hey, go drink something. Problem is, it's fun, it's summer, we're all at the pool. Sometimes we don't listen to our body and we continue, or moreover, we're replenishing it with beverages that aren't actually hydrating. Coffee, soda, tea, alcohol, these all have caffeine, sugar. They're diuretics, which means that we pee more often. Other symptoms as we continue to not rehydrate with those waters or Gatorades, our urine can become darker. We can decrease our urine output. Sometimes we can develop physical symptoms like a headache, nausea, lightheadedness, dizziness. If any of these occur, of course, we would recommend, get out of the sun, try to start rehydrating with more water.
Okay. All right. We want everybody to stay safe. Thank you for your time and your expertise. If you missed any of this, we're going to put it in the To Your Well-Being section of our website.